And lastly, sorry, before before we get started, I just wanted to say thank you to our co-sponsors for partnering with us on this town hall. Everybody is such a fantastic partner, and we're very happy to have you guys in support through this issue. So today's speakers will be myself, Sherry Cohen, Lisa Foster, and we have two lived experience speakers, John and Bright, who will be telling their perspectives of living with hepatitis B and why they believe it is so important for the universal birth dose recommendation to remain. So with that, I'm just going to stop my screen for 1 second and turn over to a couple other slides that I have. 1 second.
Michaela, you're muted, just for an FYI.
Thank you. I'm used to having 2 screens and I'm on 1 screen right now, so apologies. But just to kick it off, I wanted to quickly go over a quick timeline of how we got to where we are today with questioning hepatitis B birth dose. This had a conversation. It's been a conversation coming for quite a long time, but I think it really kicked off beginning in February of this year. So starting in February, Secretary Kennedy was appointed as HHS Secretary. He went through a confirmation hearing, and during that confirmation hearing, hepatitis B was brought up several times. News outlets were reporting at that point in time his opinions on vaccines, all vaccines, and hepatitis B vaccine in particular was one that was widely known that he was not supportive of. Then we fast forward to June 2025, and the Advisory Committee on Immunization Practices announced that they intended to review the longstanding universal hepatitis B birth dose recommendation. That announcement came with the question, is it wise to administer the hepatitis B vaccine to newborns before they leave the hospital? And this question was, as you can tell, very biased, and it definitely raised concerns, I think, among the general public that this hepatitis B vaccine might not actually be safe. And that became a topic of discussion for many months. In September, the ACIP did host another meeting where the hepatitis B vaccine was brought up. They deliberated on the safety of the hepatitis B vaccine. They compared the United States to several other countries who do not have universal hepatitis B birth dose. And they also, during this meeting and in the months to follow, reignited a discussion around vaccines and autism and trying to connect the two. And then in October 2025, we saw reports of the Trump administration and several others calling for moving the hepatitis B vaccine recommendation back to as far as 4 years of age to 12 years of age. This was also stated by FDA Commissioner McCary, who said that there was no real evidence to support giving the hepatitis B vaccine at birth versus age 10. And there was also a very heavy discussion around aluminum adjuvants, and that gained a lot of national attention. The hepatitis B vaccine is one of the vaccines that does include aluminum adjuvants in it. So we are once again part of this larger national discussion and kind of questioning the safety of this vaccine. So I have a couple of slides that I will go over that kind of talk a little bit more about the success of the hepatitis B birth dose and why it is so critical. But before I do that, I would like to take a moment to turn it over to our speakers today. So our first speaker will be Sherry Cohen. Sherry is going to give us an overview of what we are expecting to see in the next ACIP meeting. And with that, I will stop sharing and turn it over to Sherry.
Michaela, thanks for everyone for joining. I see we have a lot of people online, and I'm very glad because we've got a lot of work ahead of us. So, as just to follow up on what Michaela has said, ACIP left the ACIP committee. They left the last ACIP meeting without a vote. They were going to vote on a couple of questions related to changing the hepatitis B birth dose recommendation and universal childhood recommendation, and they wound up not voting for a number of reasons. But what it boiled down to was that they didn't think they had all of the data and information necessary to make a vote, which essentially means that we left the September ACIP meeting with no changes to the childhood and birth dose recommendations. Very shortly after, we saw some press and social media and quotes come out from administrative leadership, basically telling the community that the intent was to take this up again very shortly. And it became clear that while in September they were considering changing the recommendation for the hepatitis B vaccine to start potentially at 1 month of age with some shared decision making, that it looks as though they were going to be making more drastic potential changes this time around. So we know that we saw some quotes come out from the president and from the FDA and from RFK, the Office of HHS, that they were looking at potentially 4 years or 12 years as a start. So we did see some comments basically saying, nobody needs to get it until they're 12 years of age, unless they were born to a surface antigen positive mother. So we've been getting dribs and drabs and hints at what we think we're going to see. We also know that the Federal Register came out this morning, so there will be the next ACIP meeting, December 4th and 5th. Hepatitis B is on the agenda with a vote, probably. So we have another opportunity to share our voices and share the importance of the hepatitis B vaccine. But we also know that there is an intent here to get it done this time, right? I doubt their ACIP is going to walk away from a second meeting without voting. But I guess we don't know. I strongly suspect that it will be more drastic than last time around, just because of the information that's been kind of coming out on social media and at press conferences in the past couple of months. I don't know if we're going to be looking at a 4-year start or a 12-year start. We don't know if shared decision making is going to be part of it the way it was for some of the other September votes. We haven't yet seen questions, which should happen, and we haven't yet seen the full agenda. We don't know if Hep B is going to be on day 1 or day 2, but I think we should be getting that shortly as well. But basically, we need to prepare. We also don't know what the discussion is going to be about vaccines for children during that meeting, or if they're going to decide to pull hepatitis B vaccine from being covered under vaccines for children. What we do know is we left the last September ACIP meeting, and one of the things that really concerned me was that a couple of members of ACIP they came out and said basically that CDC was hiding data from them, or that CDC was twisting their data, and they didn't think that they were sharing robust data, and that they left out studies that the ACIP committee members felt should have been in there. And so that's concerning to me because, I was at the meetings. I think everybody was at the meetings. You can actually go down and download the CDC presentation and the slide sets. It was incredibly comprehensive. From my perspective, there was no slanting of data. I've been looking at data for years. The data looked pretty robust and accurate to me, but it does concern me because we don't know what's going to be presented in December. And we also know that, from an epidemiological perspective, unfortunately, there are ways of showing data or slanting data to make good data look bad, right? And so, depending on the questions that are asked and depending on the data that are showed, we don't know what it's going to look like and what kind of information they're going to try and use for a vote. So that's the first thing. The second thing is, and I'm so glad we have such great speakers today, but we need to prepare not only for the vote with our voices, but we need to prepare for what happens next, because we don't know how this is going to impact the childhood schedule because of the combination vaccines, and we don't know how this is going to impact production of future monovalent vaccine for hepatitis B to make sure that birth dose is available, especially for those babies who need it. So we are going to continue to work on this, but we wanted to just bring everybody up to speed. So put December 4th and 5th on your calendars for the meeting. As soon as we know more about when Hep B is on there, we'll let you know. And we'll also talk today a little bit about what we can do in the meantime. Thanks, Michaela.
Thank you, Sherry. And with that, I am more than excited to turn it over to Lisa Foster. And let me just pull up those slides for you, Lisa, and you're ready to go.
Thank you so much, and really appreciate the opportunity to be here with all of you. And this is certainly a timely meeting, given that the Federal Register notice literally came out this morning. So kudos to you for convening everyone. And I'm just really grateful to have the opportunity to walk through some of these issues in a little bit more detail and hopefully tee up a good conversation and questions going forward. So we can go ahead and move to the next slide. So just for those of you who don't know who I am, I'm Lisa Foster. I help manage the Adult Vaccine Access Coalition. We are a DC based federal policy coalition that a number of organizations around this table are members of. We're grateful for your participation. We do a lot of work in the federal vaccine policy space, largely focused around access. Up until this year, we were really excited to be promoting the new, expanded recommendations for adults. We're an adult coalition, and obviously hepatitis B remains an issue across the board. And certainly, I think as a coalition, a lot of the work that we had done over the past 10 years has been premised on the fact that we have a really strong and robust childhood vaccination system. And, when it comes to adults, it becomes a little bit more complicated. And so, but we've always looked at what we've done for children through the Vaccines for Children program and through other, other mechanisms. Any child in this country that wants to be vaccinated could get access to a vaccine regardless of insurance coverage. And so, now we're beginning to see some pretty serious assaults against our childhood vaccine system. And, hepatitis B is probably the most glaring example of that. So yeah, I don't want to spend a ton of time on this, but I just thought it's helpful to really just think about like, why is the hepatitis B vaccine important? Hepatitis B is the most common form of liver infection in the world. It is something that causes a lifetime of chronic infection. It can cause acute disease. We've had a vaccine since 1981. It was the first anti-cancer vaccine. And I think that's something that, as we look at innovation and trying to find ways to help reduce the burden of cancer in this country, this is a huge tool in our arsenal that we're now looking at the potential of losing a lot of the great progress that has been made, through the efforts of the ACIP and others. And so, I think it's just helpful to like remind ourselves why this is important. It is also, the Hep B vaccine is the most widely used vaccine in the world. Over 1 billion doses are given out each year. And it's extremely safe and effective. There is decades of research and evidence to show that this vaccine helps, eliminate HPV infection. And so, let's not forget some very basic and very important facts in all of this as we think about how we can center and position ourselves as a collective to help really address some of the misinformation that's out there and some of the potential change that could be coming down the pike in the next few weeks before the end of this year potentially. So with that, we can move on to the next slide. So, I think when you think about why are we giving out a birth dose to infants that are in the hospital, There are 25,000 infants that are born to mothers who have been diagnosed with hepatitis B each year. And approximately 1,000 of those moms transmit that condition, to their infants. Most, the vast majority don't know that's the case. Obviously we've done a lot of work around screening moms. Those efforts are not, while they're helpful, they haven't always prevented 100% of those transmissions for a number of different reasons. Timings of the test not coming through, not getting the right result, not using the correct test. So, there was a point at which the advisory committee in immunization practices and the leading experts that participate in that body made a decision that the best way to prevent this disease from being transmitted was to administer a birth dose within the first 24 hours of life, but preferably within the first 12 hours. There's been a lot of research and work that has been done to look at that and to make that recommendation. And it is the most direct and clear and effective way of eliminating any potential for that. Because, the alternative is if you're not providing vaccinations and appropriate medical care, and a lot of people don't know that they have, that they're carrying this virus, 90% of newborns that have been, affected at birth will develop a chronic condition, and 25% of those will die prematurely because of the results of that virus. So, for that reason, leading medical organizations, American Academy of Pediatrics, the American Academy of Family Physicians, and the American College of Obstetricians and Gynecologists all recommend that hospitals and health professionals protect newborns by administering this dose at every birth. So, having that universal recommendation is just extremely important. And it provides the beginning of a lifetime of protection. And I think it's important to also note that the birth dose is just one in a series of doses, which is what we'll talk about how changing the birth dose will have a cascade effect on other vaccines that are being used in childhood and efforts that have, been happening over the past many years to help reduce the burden of vaccination on parents and children and really help provide, additional support there. So in 1991, ACIP adopted this recommendation, and since then we've seen a 99% reduction in acute infections in children 19 and younger. So I think that the data speaks for itself. The vaccine has been extremely effective in preventing disease, and that evidence speaks for itself. So, as Michaela talked about and Sherry talked about, there was a September ACIP meeting where there began, a fairly robust discussion on this birth dose and the future of it. There's been a discussion about changing and delaying that first dose from anywhere between a month to 12 years of age. That's a pretty wide range and can have some pretty significant implications. I think what's important to note in all of this is that there's no medical evidence to support any delay at this point, and that there's ample medical evidence to demonstrate the potential harms in doing such a change, whether it's a month or 12 years. That mother to child transmission happens at birth, and we know that, and the evidence is there to show that. And so any delay potentially puts lives at risk. So while they tabled the vote, as we now know, we have the Federal Register notice, which is in the chat here. Natasha put that in there. Thank you for that. There's an opportunity to submit comments. There's a portal, so you can submit oral comments or written comments. You have to be picked through a lottery to do live oral comments at the conclusion of the discussion. That portal will open on November 13th and will be open until November 24th. So mark those dates down, because for those of you who want to offer comments either in writing or live, that portal and that window will be the opportunity to do that. And all that information is in the Federal Register notice that's in the chat. So I encourage you to take a look at that. We can go ahead and move on to the next slide. So why is this important, and what are kind of some of the downstream effects of this? So delaying the birth dose doesn't just affect one vaccine. It disrupts the entire childhood vaccination schedule. And what we have on the right hand of the slide is just a sampling of some of the combination vaccines that are used at various points in childhood, and to help reduce the burden of having to take multiple individual vaccines over time. There's been a tremendous amount of effort over the past several decades amongst medical professionals, epidemiologists, scientists to determine ways to help combine vaccines so that, parents aren't having to go and take their children in to get vaccinated, so many different times. And I think one of the interesting dichotomies for me when you listen to a lot of the rhetoric that's being espoused is the conversation around, how many vaccines kids are getting, but the actions that are being taken are only going to make that childhood vaccination schedule more complicated. And as was referenced earlier, the Vaccines for Children program is a federal program. It's been around for over 30 years. Over half of children in this country are accessing vaccines through that program. It is tremendously important for public health. It is tremendously important for pediatricians and other primary care providers that are providing vaccines to children in this country. But unfortunately, the way the law is drafted, an ACIP recommendation is required for a vaccine to be covered through that program. And so we've already seen a little bit of the potential disruptive effects that ACIP can have on the Vaccines for Children program. There had been a lot of conversation about the COVID vaccine and whether or not kids would be able to have access to that vaccine. Those conversations had a direct impact on that program's ability to purchase vaccines and make those vaccines available to healthcare providers across the country. And so, if people are saying, and the rhetoric is saying, well, we're not taking away anyone's ability to get vaccines, that is simply not true, because the decisions that are being made by this body have a direct impact on whether or not vaccines will be available. And so I cannot emphasize that enough. So that's one piece of it. So if you eliminate or delay the birth dose, it then sets off a cascade of events that have an impact on the vaccine supply chain. Decisions to change vaccines can take manufacturers years to adopt those changes. As you might imagine, vaccines are a fairly highly regulated product that go through intensive review by the Food and Drug Administration. So any changes to a vaccine or a facility that produces vaccines have to undergo a rigorous review. So, a delay of the birth dose will have an impact on, the supply of not only hepatitis B vaccine, but some of these other combination vaccines that a lot of providers have come to rely on to help reduce the number of vaccinations that a child has to get. And again, these things have all been thoroughly studied and tested and have been, demonstrated to be effective, and not, have significant, safety issues. And so it's concerning across the board, and just, really appreciate the opportunity to share a little bit of this information with folks and look forward to the discussion. So thank you.
Thank you so much, Lisa, for that. And now I think I would like to turn it over to our two lived experience experts. We have John and Bright on the line. John, would you like to kick it off?
Yeah, certainly. I think, a lot of this conversation around vaccination, I'm kind of a living example of the risks of delaying hepatitis B vaccination. I was born in 1990. Prior to the 1991 recommendation of birth dose, I was born to a registered nurse, someone who is, intimately familiar with health and wellness. She worked in the emergency room. And so I did not get the hepatitis B vaccination at birth. I was slated to get the booster vaccinations at the age of 12. And I discovered at the age of 16 that I had at some point in my youth contracted hepatitis B. So, I think the recommendation of delaying to as late as the age of 12 years old, there's a lot that can happen, for children as far as getting exposed to hepatitis B and contracting it. So that's a little bit about my personal story. And I think, like I said, it's kind of illustrative of the risks that come with delaying birth dose.
Thank you so much, John. And Bright, can I invite you to share a little bit about your personal story and why you think vaccination is so important?
Sure. Thank you for having me, and I appreciate the opportunity as always. Uh, so to me, I think the hepatitis B vaccine is very important for a few reasons. As Lisa has mentioned, so one reason is that the vaccine is the most effective way to prevent hepatitis B among young children or infants who are at their most vulnerable, the most vulnerable population to hepatitis B, if you ask me. Also, being infected in childhood increases one risk by about 25% of developing liver cancer. And if we are able to vaccinate children or infants, that will eliminate that risk of liver cancer exposure later in life. Vaccinating children also do provide, it gives parents a peace of mind knowing that they have done everything to protect their child, and at least they can take that off their list of responsibilities as parents and focus on something else to help with their children. It also spares children from the impact of having to live with hepatitis B. And I can't tell you, hepatitis B just doesn't impact the liver, but it also impacts the entire life of that child. And so vaccinating that child completely eliminates or spares that child that trouble. Also, we know the vaccine is safe and is effective at preventing infection. And I can't tell you how many times I have to look back and ask myself, why wasn't my mother tested when she was pregnant? No, why wasn't the childbirth dose vaccine made available when I was born? Because I think if that was around, if my mother was tested and the birth dose was available and given to me, it would have prevented me and my siblings from contracting hepatitis B and having to live with the impact as an adult. So those are the reasons why I think the birth dose vaccine are important. Thank you.
Thank you so much, Bright and John, for joining us. And I think they highlight two very strong arguments that we are having right now in the United States. Bright's with, we test every mother, but we know we're not testing every mother for hepatitis B. People do fall through the cracks. And then John and his story with why do we need it at birth if the mother doesn't have it? Well, we can see right there that there are things that happen that we need to protect babies from when it comes to universal hepatitis B vaccination. That's exactly what it does. So I really appreciate you guys joining us today for that discussion. I have two very quick slides that I will share with you all before I turn it over to the audience for discussion. So please feel free to drop any questions that you might have in the chat or to send them to myself or the Hepatitis B Foundation in the participants log. But very quickly, we have information, a new model that has just come out from the, one second. There we go. The Center for Disease Analysis Foundation has worked on a model on the hepatitis B birth dose and why it's so important to get this vaccine at birth. So as you can see on the screen here, on the bottom are the two models that they did on what it was like if we did not have any sort of universal programming for hepatitis B birth dose. And so you can also see the facts right above that can say how many lives were saved due to hepatitis B birth dose. You can see how many infections, acute and chronic, that were prevented. But you can also see how critical the Vaccine for Children's program is, and the role that it's played in making sure that anybody who really wants the vaccine has access to it, no matter cost, no matter any barriers. So I just thought this was really important to highlight. So on the two models, you can see the red line, which is definitely far higher, is the line that would have been infections in acute or chronic if there had been no universal hepatitis B vaccine programming. And on the second slide, we have a model by the CDA that is similar, but what it's projecting is if we do move to having an adolescent start date for hepatitis B birth dose, what that would look like in the United States. So the green line is the adolescent vaccination that you can see. And just as predicted, we would see far more cases in acute and chronic hepatitis B infections if we start adolescent vaccine between 12 to 14 years of age. And that is not something that we would want to see. That is something that we would hope to prevent. So thank you so much to the Center for Disease Analysis Foundations for making those models. I think they are really helpful and will be really impactful as we make our arguments moving forward for protecting universal birth dose. And with that, I will stop sharing. I believe we have a couple of questions in the chat. The first one is, have there been effective arguments around household transmission? And Sherry, can I turn it over to you to kick it off with that? Oh, she might have stepped out. Oh.
Just getting my
Hey.
camera on. Yeah, can you repeat the question for me, Michaela?
Sure, it was, have there been any effective arguments against household transmission or for household transmission?
Oh, I guess it depends on how you define effective. You know, I think I'm happy to start and then hand it over. We know there's significant data over the past 40 years that household transmission occurs, and we're not exactly sure of all of the routes of transmission. While hepatitis B is not casually contact, it is a highly infectious virus, meaning you need a lot less virus, a lot less amount of blood, or a lot less virus to transmit than you would for other infectious diseases like HIV or hepatitis C. It's an infectious virus, and per amount of blood, there's usually a lot more virus. We know it can happen in households. The other thing that really concerns me, which I think we don't necessarily, that maybe not everybody realizes, is the fact that there are so many people undiagnosed in the US. So, you know, most people in the US who are living with chronic hepatitis B don't know they have it. Only 25%, about 25% in the US that of people who have hepatitis B are diagnosed. And most people don't think they're at risk either, right? There's so many misperceptions and lack of awareness about hepatitis B. People don't know that they're at risk and don't think they're at risk. And I think a lot of times we are bringing kids home into situations where they're being exposed. And it's not only in the household, by the way. I mean, we just got back from ASLD, and we were chatting with Brian McMahon, and many years ago, they did assessments in daycare settings where there was, you know, where in a setting where they knew that there was chronic hepatitis B in the community, and there was virus in the daycare setting, and it could be a potential way of spreading if you have blood-to-blood contact. And so it's the environment that babies go home into. I think the argument there is you want babies to be protected as soon as you possibly can protect them, because, and I can't stress this enough, hepatitis B causes liver cancer. And when you are infected as a baby or a young child, your risk of getting liver cancer is the same as if you start smoking a pack a day of cigarettes at birth. Who wants that, right? And so I've never heard, I mean, I think there's enough data to suggest that we know hepatitis B can be transmitted outside of mother to child, and it can happen in the first month or months of childhood. I don't know if that answered the question. I hope it did.
Yeah, I think so. And I will also, thank you for saying that, Sherry. I will also point out that what you mentioned around liver cancer, it seems like something that is so obvious, but if you have listened to any of the discussion around this at all, it is not being brought up enough in the ACIP committee. It is not being brought up enough that hepatitis B is liver cancer, hepatitis B vaccination is liver cancer prevention. And that is a message I think the community would do really well with promoting about why it is so important to get it at birth and to make sure we're preventing a lifetime of the potential threat and thought of liver cancer even. Lisa, I think you raised your hand.
Yeah, no, I just, I always hesitate to talk about, things that are more in the science realm because I'm definitely not a scientist. But I think when you think about the virus and the fact that it's able to survive on surfaces for 7 days, just thinking about your example of daycare, I mean, it's something where if you don't know you have it, there's, you know, just the risk of exposing other people when you yourself don't know that you're a carrier is, I mean, you cannot overstate that risk. And I think, the fact that ACIP went above and beyond and saying that we should go ahead and capture people like me who didn't get the birth dose because I was outside of that window, and catch up to the age of 59, I think is indicative of what the risks are of that virus and the fact that there's a vaccine that helps prevent disease and that you want to capture people as soon as you possibly can. Because the lifetime that you're is entirely preventable, and having the health effects of that, and we have a vaccine that works. So, and somebody, it looks like, just put a study in the chat. So I think there's just a tremendous amount of scientific evidence out there to demonstrate the clear public health benefits of this vaccine and its use at birth. And I know, I don't know if we want to get to a conversation about the adjuvants and the fact that aluminum has been, implicated. But, there's certainly a lot of good evidence out there as well, on those pieces, which again, I'm not a scientist, I'm not a physician, so I'm not going to comment on that, but just, I think there's a lot of ways that we can collectively come at these issues.
I agree. And there are a ton of resources that we can also be happy to share with you all, just so you guys feel prepared in answering any questions or writing your own public comments. So the next question is that ACIP in September, the table vote had a mixed result. Is there anything that we learned from the last effort that we can use to inform the strategy for the meeting in this December? It's a really good question.
I'm happy to start if you want and then kind of hand it off. So I actually think we did a really great job last time around. And you can tell because I think the hepatitis B vaccine the ACIP meeting and the vote and we're in the new mainstream media like 25 times within a week or two. It was in the New York Times, it was in Bloomberg News. It was in the Washington Post. We got on 6 ABC, Good Morning America. So here's my perspective is this, and I try not to be too pessimistic, but here's how I see things. This vote's going to happen. I don't think that we are going to necessarily change the ACIP's meeting or RFK's decision. I don't think that's going to happen because I don't think that they're making a decision based on scientifically backed evidence or data. They're going to vote based upon what their own agenda is. And I'm not sure that anything we can do can change that, although I hope I'm wrong. However, the more conversation and buzz we create around this and the more accurate information we get out there, the more pushback there will be. And then the more we can save once this comes out, right? I mean, this is our incredible opportunity for us to be sharing facts and information and creating support, addressing misinformation, and essentially addressing vaccine confidence. I mean, I think this is an opportunity. Every challenge is an opportunity, and this is one. I think the strategy is get as much press as we can about this, and that for us also doesn't mean only addressing our strategies at ACIP, but it should be addressing them out in the community through social media with our family, friends, and family and friends and partners. I mean, that's kind of how I think of it, and I know that may sound a little pessimistic or a little simple, but I think that's what we need to do.
Yeah, no, I was just gonna say, I mean, I think to Sherry's point, I appreciate her optimism and sort of optimism, but I think we do have to sort of work our way back from the ACIP meeting, right? And having robust comments in there, both live and written, super important, but continuing to work our way back from today, right? And getting information out into the public domain, whether it's through social media, through talking to the press, through talking to colleagues, through writing op-eds, whatever the case may be, whatever position that you're in that can give a voice that's accurate and fact-based or personal stories. I think the more that we can be flooding the zone, so to speak, is the best that we can do, because I think most Americans are not thinking about these issues on a day-to-day basis and won't realize the impact until it's far too late. And so being able to use our voices now and leveraging those voices effectively is our best hope to really influence kind of the process going forward. But I do agree. I mean, I think the deck has been stacked, and the cards are going to fall where they may. If I keep using all the card analogies, I'll stop. But I just think we have to be thinking from like this moment onwards. We now know when the meeting is. They've publicly announced it. Let's go forward and try to use our voices collectively to help counteract the misinformation that we know will be very prevalent at that meeting.
Then Bright, you had something you wanted to say?
Yeah, just two quick comments. So one is on the upcoming ACIP meeting and what decision they'll be making. And one thing I want to say is that it will still be good that we continue to make our voices heard. Definitely, probably not here in the US. We might not see the impact because of these changes, but it's funny that because of organizations like Hepatitis B Foundation and other patients organizations, we have other countries now having the BEV, introducing the BEV dose in those countries. So it's funny that the US is going backwards, and we see other countries, especially in the developing worlds, they're working hard to make it to make it a policy where every child is vaccinated. And so I think we need to continue to make our voices heard and continue to be sounding off about the risk and how dangerous a virus, hepatitis B, is. And also, just to add to the conversation about the household transmission, it's funny because that's one way that patients are impacted by hepatitis B, because once you have hepatitis B, then you start thinking about how you start thinking and living with the fear of possibly exposing others. And so it becomes a form of, I use the analogy as an OCD, you clean every surface, you clean everything you touch, you try to isolate yourself from social events because you have this in your mind, and you're trying to do everything possible to prevent any form of exposure that may happen. And so that's a stress that I don't think anybody sign up for, but unfortunately, that's what we have to deal with as patients. So I just wanted to throw it there, this out there, that why it is important to prevent any form of transmission in the household. We also have to look at it. I also have to realize the impact. As I mentioned, that hepatitis B just doesn't affect the liver or impact the liver, but also it impacts the life of every patient, the entire life of a patient, in multiple aspects that we often don't hear of, and patients suffer in silence. So I just wanted to mention that.
Yes, thank you for that, Bright. I think that's a very strong point that you made, that one of the reasons I think hepatitis B has been a little bit under the radar for a while is because people do see it as an invisible disease. They don't see what patients go through and what they think about on a day-to-day basis, because of what they're living with. So I really appreciate you highlighting that point. And on that note, Bright and John, we had a question for you. So from your perspectives, do you have any thoughts on messaging to policymakers or decision makers who could have an influence in this decision? And I think that's a really great question, because while all of this is happening on the federal level, there are decisions regarding vaccines that states do make, right? And we've seen certain states, make certain protections for vaccines to really make sure people have access for it. So do you guys have any thoughts on messaging that you believe would be strong for policymakers or decision makers to hear around vaccination?
Do you want to go ahead, Bright? Do you have any thoughts or ideas you want to share?
Yeah, I think it's always important to have the patient voice be heard, and all these forms of advocacy, whether it's being at the local, state, or federal. I think the patient's voice is always important. We can't do without statistics, but I think if we have statistics and then we have the patient voice, I think both can make a real impact in whatever we try to advocate for. So that would be one way that I think it can help, is to make sure that whatever we do, that there is the patient's voice, is because we bring a perspective that is not, as Makela, you mentioned, it's a perspective that is often hidden. Oftentimes we only focus on the liver and that's about it. But probably hearing as a patient talking about how personal hepatitis B affects me, I think it's something that people need to hear and understand. Because most of the time they don't hear about it. I mean, I can't tell you how many times I walk around and people see me and say, "Oh, you look good," but I don't feel good. Personally, I know I don't feel good. Why I look good, I don't feel good. So until you tell somebody what you're going through, people just don't understand. They just look at the physical appearance and think of it. So maybe just having patients more involved, uh, and having a seat at the table to engage in such conversations, I think it's a good way. And maybe sometimes we also have to look at it from just take baby steps. The little things might be so if we can convince one state rep, I think that's a start. Then probably trying to look at, maybe try to convince 30 people at one sitting. So maybe taking baby steps in a process, I think would be helpful as well.
Well, and just to piggyback off of what Bright shared, and I really appreciate you sharing your story, Bright. Thanks for what you do. I think in large part, I live in Pensacola, Florida, and we're in the South, and I think to what Sherry said earlier, there are a lot of misperceptions, and just overall misunderstanding of what hepatitis B is and who it impacts. I think, to be blunt, a lot of people assume that this is an African problem or an Asian problem. This is not a problem that we face in the US. And I think in a lot of ways, like even my own personal experience of getting diagnosed, my mother was a nurse, and she thought hepatitis B was a thing of the past, right? Like, we have a vaccine, we don't need to worry about it because no one gets hepatitis B anymore, right? I've seen some of the commentary around mother to child transmission, and I think some people perceive that that's like one of the major ways, or one of the only ways, right? I've also seen some commentary about drug use and things like that. I was 16 years old when I was diagnosed. They estimated, based on the scar tissue on my liver, that I had contracted it, possibly as early as 3 or 4 years old. So, just educating really, and sharing our stories, and I think advocating for reasonableness, fact-based, science-based decision making, not emotional or anecdotal decision making.
Thanks, and that's a fantastic point. And I think that is something that perhaps it would be beneficial if we repeat more often, is that questions are normal and questions are good. You can ask questions about a vaccine, you can ask questions about a virus, but when we start going, to the wayside is when we start making decisions that are not based in the actual evidence and the science. And as Sherry mentioned earlier, and as Lisa mentioned earlier, none of the data and the science around the hepatitis B vaccine has changed regarding its safety, regarding its effectiveness, regarding what it does to prevent this disease. And so the more that we say that, we don't mind questions, I think we're kind of welcoming them actually, so that we can combat a lot of this misinformation, I think would be really, really helpful. So the next question that we have, and we are coming up to the hour, so if anybody has any final questions, please do feel free to just drop them in the chat if we don't get to anything. When we do send around follow-up, we'll be happy to answer them there. But a person asked, will the ACIP meeting that is now scheduled for December 4th and 5th still be held if the government is shut down? And how is the CDC going to prepare for it if they aren't working right now? Lisa, I'd love to
I'm
put this to
happy
you.
to jump in on that one. Yeah. This is a space where I am comfortable speaking, with some degree of knowledge. So it looks like if the House is able to get itself organized, they're supposed to be voting, I think, later this afternoon on a continuing resolution that would reopen the government until at least January 30th. And then included with that is they're passing 3 full-year bills, appropriations bills that would cover the FDA and the Department of Ag, military construction programs in the VA, and then the ledge branch, so Congress, Supreme Court, things like that. So that passed the Senate on Sunday night. So they did a motion to proceed and it passed earlier this week. My days are getting blended together now, but so it looks fairly likely that the government will reopen. And I know, staff at CDC who work behind the scenes, helping to support ACIP, had been called back already. They had been furloughed and then had been invited to come back and work without pay. I think in anticipation that they were, going to have this meeting. So I think, there shouldn't be any interruption in that sense, given how things are aligning on Capitol Hill and what appeared to be happening behind the scenes at CDC as well. I hope that helps answer the question.
Oh, perfect. And so I do have a final question that I think would be helpful for us. So I think based on this conversation and based on everything that we've heard, we know that a change is likely coming regarding hepatitis B vaccine. Although we don't know what the final result will be, we do know that we're most likely looking at a removal of universal recommendations for birth dose. So that being said, what does this is a loaded question, I will caveat that. What does the future look like for us in this room here? We are health departments, we are community advocates, we are, immunization stakeholders. What does the future look like moving forward, protecting access to this vaccine and just ensuring that people can still get it?
That's a fantastic question and very loaded indeed. I am not going to go first on this one, but I think, I'm going to follow Sherry's lead on this because I think she's much more knowledgeable than I am.
We could rock, paper, scissors. I think it depends on what happens from the vote, right? It depends how much is going to be knocked down and how much do we have to rebuild is the question. But so this is what I think. We're gonna have to work hard. We're gonna have to do more education and awareness. We're gonna have to be bolder about very being outspoken about the hepatitis B vaccine and continue. Some new immunization coalitions have been created this year because of this. And honestly, we are working with partners we've never worked with before, including the American Academy of Pediatrics and folks that are not in the Hep B space, but are in the vaccine space or the PED space. And so that's the answer here. We're going to have to keep continuing these collaborations. We're going to have to keep working with industry to make sure that to really push for these vaccines to be continued to be manufactured. I also think for those of us that are able to do state level advocacy, we're going to have to continue efforts to do a lot of state level advocacy to see what can be saved in terms of coverage, and continue to do federal advocacy as well. I mean, I think it's going to be a lot of work, but I also think we're primed for it. We're halfway there because we've set up all these relationships. And if Hep B vaccines, it's almost like an if it's not removed from vaccines for children, that's one less thing we have to worry about, right? So, and we have to see what happens with these other vaccines too, because that they may be upending the entire schedule, in which case our work is bigger than just the Hep B vaccine. So I think it's going to mean a lot of partnership and a lot of continuing to spread the word.
Yeah,
And Lisa,
and I think
please
just,
jump in.
totally agree with everything that Sherry said. And I think just thinking about, if you throw a pebble in the sea, right, the pebble has an impact, and then there's these cascading events that happen, right? And again, we don't know how far and wide these things are going to impact. But what I do know is that we've made a tremendous amount of progress as a nation in eliminating hepatitis B, right? We have generations of kids who have benefited from this. But we also know that there's gaps, right? And I think some of the points that Bright made earlier about, other countries are following the US's lead in this space and realizing that the best way to protect the maximum number of people is to have a universal recommendation at birth. And I think we have to push past a lot of the misconceptions that are being raised in these contexts now. And frankly, a lot of talk that's very marginalizing of people and being able to use your voices. And I really appreciate John and Bright, you coming on today and sharing your stories, because I think that's how we break those barriers down. It's your neighbor, it's your friend, it's your school teacher, it's your, your childcare provider. It can be anyone, and it doesn't, the virus doesn't care. And so why would we, in a universe where we know we have a vaccine that works and we know it provides protection, why would we disrupt something that we've taken decades to build and to protect, to protect people? So I think, when you think about kind of the impacts downstream around the Vaccines for Children program and other things, those are things that are going to impact, all Americans, right? I mean, if 50% of kids in the United States are getting access to vaccines through the VFC program, people are going to figure out pretty quickly if they're not able to take their, child to their pediatrician and get their, whatever the combo vaccine that they were told, 3 months ago to come back and get. So I think, it's been interesting to watch some of the conversations on the ACIP, because it's clear that they are just flying by the seat of their pants too. I mean, and some of the things that people raise, I mean, not much surprises me anymore, but I am shocked. And then other people who come in and actually present a more reasonable perspective, I think has been helpful. So I think to the extent that, again, like, we can flood the zone in advance of this meeting and get information out there to the press, to, different constituencies, getting on podcasts. Like, I'm not a podcast person, but maybe John, you are, like, getting your voice out wherever it can be heard. I think it's going to be incredibly important in this moment so that people are aware and informed of what is, potentially coming down the pike here. And while we might not change what they decided, at least we can give people a warning that what is coming, or potentially what is coming. So.
Thank you. I think that was really well said. And John, I think you have a new career as a podcaster coming up, so look out for an email.
Or
But,
Substack, whatever your
Don't threaten me.
mode of communication is. Like, I appreciate the young people and, alternate, modes of TikTok. I don't have TikTok. but
Maybe
I
we'll
know
get you on
my
TikTok,
19-year-old son
Bart.
gets a lot of information from TikTok and tells me, I'm like, wow, I didn't know you were even aware of that. So
That's just how we get all of our information nowadays. Breaking news is on
yeah,
TikTok, but it's okay. Sherry,
yeah,
Bright,
exactly. Well, we got
John.
to use it. We got to use it to our favor. I mean,
Yeah,
so
absolutely. Well, Sherry, Bright, John, and Lisa, thank you so much for coming on today and sharing your expertise. I think this has been an incredibly enlightening conversation, and I think we highlighted a lot of the reasons why we should be working to protect universal birth dose, and I think we certainly have our work cut out for us in the coming weeks. Please do pay attention to your emails. We'll be following up with resources and links to make sure that everybody is well prepared for the upcoming December 4th and 5th meeting for their public comment period. And thank you so much for joining us, and the rest of you have a great day.
Thank you, everyone. Thanks for your advocacy.